Welcome to the deep dive.
Mm.
We've got quite a stack of material here you shared with us,
Mm-hmm.
and it points us, well, straight into the heart of a really interesting political situation unfolding right now in Washington.
That's right. Yeah, the material we're diving into today, it lays out this whole scenario around a pretty significant piece of legislation.
Okay?
The sources actually call it a big, beautiful bill at one point.
Hey, okay, big, beautiful bell.
But the interesting part is it's facing some maybe unexpected, pretty sharp opposition, and from within the Republican Party itself.
Right, and a really, vocal part of that opposition seems captured in this quote you flagged from Senator Rand Paul.
Ah, yes.
He's apparently urging conservatives to, stand up against it, famously saying, "The emperor has no clothes."
Quite a statement.
Yeah.
And the central issue here, the real friction point, according to the material, is the bill's potential impact on Medicaid.
Medicaid, okay.
Specifically, there's this claim, and the source attributes it to the CBO, that's the Congressional Budget Office.
Right, the independent estimators.
Exactly. The claim is that this bill would essentially strip Medicaid away from, get this, 14 million Americans.
14 million. Okay, let's dig into this because the context here is key, and the material lays it out.
Mm-hmm.
Republicans have that narrow Senate majority, right?
Mm-hmm.
53-47.
Tight, very tight.
And they're trying to use budget reconciliation to pass this, which, is that special process. Lets them pass it with just a simple majority.
Right.
Avoids the filibuster.
Right. No 60-vote threshold needed for certain bills.
But, and this is the crucial detail the sources hammer home, if just 4 Republicans defect, just 4, and vote, no, the whole thing dies completely.
That's the math. And the sources, they actually start naming names, or at least highlighting key figures to watch, potential points of defection or, pressure points.
Okay, like who?
Well, Rand Paul, for one, he is presented almost as, defection number 1 if he sticks to his guns.
Based on that emperor quote.
Yeah. And then Josh Hawley is mentioned. And also Susan Collins and Lisa Murkowski. The material really focuses on their states, Maine and Alaska, and the specific pressures they're facing.
Got it. So our mission then for this deep dive is really to unpack all that. The claims, the numbers, the political dynamics that are presented in this material you shared.
Mm-hmm.
Looking at this opposition and, the potential fate of this bill.
Exactly. Let's get into it.
Okay, so Rand Paul. The material seems to see his comments as, well, more than just talk.
Yeah, it's framed less like, subtle positioning and more like an outright declaration, like he's actually prepared to vote no.
Potentially being that critical first no vote.
Potentially.
Yeah.
And that emperor has no clothes line, it really sets a tone, doesn't it?
It does. It frames it as this fundamental critique. Like he's telling fellow conservatives, hey, don't just fall in line here. Question this. Especially on fiscal responsibility grounds, what he sees as conservative principles.
And if you connect that to the bigger picture in the source material, it's not just Paul. The material also points to Senator Josh Hawley kind of planting his own flag against stripping Medicaid from those 14 million people.
Yeah, and the sources quote Hawley pretty directly, saying something like, the right thing to do is not to cut Medicaid, calling it basically wrong to cut health care for the working poor. And the material notes he emphasizes these are, working people, their kids.
People who need the health care can't afford it otherwise.
Exactly. Can't afford it on the private market.
So this brings up something the sources highlight quite clearly. The different sort of angles of criticism coming from within the party.
Different reasons for opposing the same bill.
Precisely. The sources sort of suggest criticism is coming from, let's say, different ideological wings within the GOP. You've got Paul, right, focusing on the fiscal side, maybe betrayal of conservative principles, spending.
Yeah, the emperor has no clothes angle, fiscal responsibility.
And then the way the material presents Hawley, it's more focused on the human impact, the impact on actual people.
Acknowledging, this bill is going to hurt Medicaid recipients, specifically the working poor.
And the sources kind of suggest this offers, different justifications, different paths for opposition within the party itself.
Okay, so Paul, Hawley, then the material shifts focus to Senators Collins and Murkowski.
Right. Susan Collins from Maine, Lisa Murkowski from Alaska. And the sources use some strong language here. They suggest these senators should be absolutely terrified about this bill.
Terrified? Why?
Because of the sheer number of people on Medicaid in their specific states. people who could lose coverage if this bill passes.
Okay, hit me with the numbers. The sources laid those out.
They did, and they're pretty stark. In Alaska, Senator Murkowski's state, the sources say over 246,000 people are enrolled in Medicaid.
Over 246,000. How big is Alaska's population?
Well, according to the sources, that's about one-third of the entire state.
Wow, okay. And Maine, for Senator Collins.
Over 320,000 people on Medicaid, which the sources calculate is nearly a quarter of Maine's population.
A quarter of the state. So huge numbers in both cases.
Massive numbers. And the sources directly link this to the political difficulty. They basically ask you, the listener, to imagine what that means.
Right.
Think about Senator Collins going back to Maine and having to explain to, over 320,000 constituents why she voted to take away their health care.
Or Murkowski in Alaska, facing almost 250,000 people and saying, sorry, your Medicaid's gone.
Exactly. And the material emphasizes these aren't just abstract numbers. It talks about working families, the elderly, children, people with disabilities.
Real people, real impact.
It even points out, specifically for Alaska, that over 70,000 people there gained coverage just through the Medicaid expansion part.
So these senators would effectively be voting to, as the source puts it, rip health care away from huge chunks of their own states.
That's the argument presented, yeah. And the material notes that both Collins and Murkowski are reportedly already nervous about the bill. They've expressed concerns before about cuts to social programs.
And they're generally seen as more moderate Republicans, right, from states that rely quite a bit on federal programs.
That's how the material characterizes them. Moderates who, care about their reputations back home.
So does the material suggest Rand Paul speaking out helps them at all?
Actually, yes. It suggests Paul doing this publicly kind of provides political cover.
How so?
Well, instead of maybe being the lone Republican voices against the bill or among the very first, they can now, according to this framing, sort of join Paul in standing up to what he's calling the emperor with no clothes. It makes it less politically isolating, perhaps.
Interesting. So Paul going public might embolden others who were maybe hesitant.
That's an implication the sources raise. The fact that Paul feels he has to speak out so strongly might suggest others share similar concerns, but are, maybe quieter about it, perhaps worried about primary challenges, that sort of thing.
Okay, so let's sort of pull this together. The core tension here, as laid out in the material for you, the listener, is this bill presenting a really significant challenge for the Republican Party, but especially for certain senators like Collins and Murkowski facing intense pressure because of how it could impact health care for so many of their own constituents.
Yeah, the material you shared really hammers this point home using those specific numbers. Over 320,000 in Maine, almost a quarter of the state. Over 246,000 in Alaska, about a third.
Huge numbers.
And the sources argue pretty forcefully that this creates just enormous political difficulty for those two senators in particular.
And like we discussed, the material also highlights those different angles of criticism bubbling up within the party.
Right. You've got Rand Paul on the fiscal responsibility track, conservative principles.
And Josh Hawley, as the sources frame it, focused more on the morality, the wrongness of cutting health care for the working poor.
Yeah, the sources describe it as criticism coming from, quote, different sides within the GOP structure, different rationales leading to potential opposition.
But crucially, the material doesn't say this is a done deal.
Not at all. It strongly emphasizes the opposite. The bill's fate is described as very much in play.
Still undecided.
Definitely. And public pressure, things like contacting representatives, is presented in the material as a potentially critical factor in what happens next.
Okay, so wrapping this up, what's the final thought for you, our listener, to take away from all this?
Well, consider this, drawn straight from the material.
To what degree can these specific state demographics, like having a quarter or a third of your state on Medicaid, and the potential impact on so many constituents?
Especially for something as essential as healthcare access.
Right. To what degree can that really influence decisions in Washington? Can it actually, cut across the usual party lines?
As the dynamics presented in this source material seem to suggest, is at least possible.
Something to think about as you process all this information from the sources we've unpacked today.